So what impact will the spread of COVID-19 to at least 60 countries around the world have on travel? And what are your rights as a passenger if an epidemic becomes a pandemic? What protection does travel insurance offer? Well, joining me now is Insurance Council CEO Tim Grafton. Good evening, Tim. Can you actually still
Good
get...
evening, Lisa.
Hi, could you actually get travel insurance right now that would cover you if you were affected by the fallout from COVID-19? Is it possible?
So, generally from most insurers at the moment, it's become a notified event or regarded as an epidemic, and depending upon when you purchased your insurance, it will depend upon whether you might have some cover in place, and there are one or two insurers who are still providing some cover. So the general advice to the public would be to talk to your insurer or insurers if you're inquiring about whether or not you would get cover.
So when you say that some insurers are offering some cover still, what do you mean? What cover?
Well, okay then. So some may provide some limited cover for medical expenses associated with COVID-19. Some may, depending if you've purchased an additional product, provide some limited cover for a cancellation of travel, but it tends to be reasonably limited and certainly off limits with respect to any travel to China and Iran.
Yes. So, for example, can we take America as an example, where obviously health expenses are extremely high? So if you're in America and you were affected by COVID-19 and had to use the health system there, you were taken to hospital, would a policy cover you?
So, like I said, I can't give a simple answer to that because it depends when you purchase your cover. It depends, what your individual policy might say. So I can't give you a black and white answer to that. As I said, there are some few insurers providing some cover in that respect, but a lot are not.
And so cover in that respect...
It depends when you purchase the insurance as well.
Sure. So what is the cutoff date that insurers are using? I looked online.
There is not one thing. It's not a simple, straightforward answer because different insurers applied different dates around what occurred. So there were certainly dates in January that started to trigger a known event of an outbreak in Wuhan and Hubei province in China. Then last month, there were insurers issuing a declaration that this was an epidemic, and therefore from that date on they would be applying an epidemic exclusion. So, as I said, the best advice I can give, because of different dates, because of different covers and different policies, it would be best to talk to your insurer to see the extent to which you are covered for any issues related to COVID-19.
Given that you say there's only a few members that are still offering insurance that has an element of cover for coronavirus, I'm imagining that comes at a pretty penny, does it?
Again, I don't know the pricing of it. It tends to be more the limitations that come with it. That there is possibility of purchasing a cancellation a policy, so if you were cancelling travel, but in order to get that benefit, it's an additional cover that you purchase, and you need to purchase that within...
So is COVID-19, sorry to interrupt him, but is COVID-19 pushing up the price of travel insurance?
No. What COVID-19 is doing is limiting the cover for any matters that lead to additional costs from travel associated with COVID-19. So the price of travel insurance, remember, and still worth purchasing, is covering you for all other medical expenses, broken limbs, accidents, loss or theft of baggage and goods, and cancellations of which bring added costs for all sorts of other reasons you might be travelling.
What are your members telling you about this and the impact it's having on them and their industry?
They're getting a lot of inquiries from the general public around the coverage of COVID-19 if they were deciding to travel or not. And so really it's a surge in inquiries around what does the travel insurance that you are selling cover me for? And people are ringing up various insurers to shop around and understand what covers they might be able to obtain.
Do you anticipate a downturn? Because arguably some people will decide not to travel because the risk is too high. So generally the uptake of travel insurance could go down. Are you anticipating that kind of downturn?
It's difficult to say because equally we've seen, for instance, airlines offering some very, very cheap flights, and so that may entice more people to travel. But our expectation is that people should be taking out travel insurance for all sorts of other reasons other than COVID-19, even if they may not be able to get cover for COVID-19. So, all the other medical expenses, even, if you went to the States, very expensive medical care there, getting cover for that, or, for theft, cancellations of flights for other reasons and the like.
Tim, would you travel overseas without cover for COVID-19? Would you go to the States, California?
Well, currently I am booked on a flight to Europe via Singapore in 2 or 3 months' time. So at the moment I'm currently heading there. And
have you got travel insurance that covers you for COVID-19?
No, I have travel insurance in place, and for COVID-19, I believe so.
Might be time to read that policy. Thanks for joining us. That is Insurance Council CEO Tim Grafton there.